The hidden truth about Ulthera. Is it worth it? I'm Dr. Angela Sturm. I'm a double board certified facial plastic surgeon, and here's why I don't recommend Ulthera to my patients. There are a number of reasons. One is it's a non-surgical treatment, and with that you have to accept some pros and cons. It's not going to be surgical results. None of the non-surgical treatments are surgical results, and I don't think that our technology will get to the point where they are, but yet to see. And so for what you're paying for the expense, for the downtime, that sort of thing, it has to be within what you're looking for as far as results go. The pros are it is less downtime, it is a little bit lower price point, but if you do Ulthera more than once, I would say consider a surgical option because although it is a lower price point, it is still not low. The main reason I don't recommend Ultherapy to my patients is whenever I do facelifts on people who have had Ultherapy, there is more scarring than some of the other non-surgical treatments. So the planes are not as distinct, the dissection is a little bit harder, and the tissues don't move quite as well. And so you still can get a good result with it, but it may limit your result to a certain degree. So if you're thinking about having a facelift in the future, or that might be something that's on the table later, these are things to know about now whenever you're making those decisions about what you're going to do and the ways that you're going to take care of yourself right now with that in mind. And so keep in mind your outcome. Is that going to align with what you're looking for? Does the price point make sense to you? And then also, if you have potential for surgery like facelifts in the future, that result or how difficult the surgery is. And so all things to think about and things to know before you make the decision to have Ultherapy. With Ultherapy, it is not painless. This is not a painless procedure. This is something that can be uncomfortable. And I actually used to do a lot of Ultherapy in my previous practice, and I would do lidocaine blocks. So kind of like when you go to the dentist, I inject that numbing, and it does make the procedure a lot more tolerable. But in most places where you get Ultherapy, they don't do those blocks. Feels like little pokes. In some places, it's more tolerable than others, and the procedure can take anywhere from 30 minutes up to 2 hours. And so that is a long time to have a procedure that is maybe not so comfortable. And I think whenever people make the decision for, am I going to do this procedure, or do I think this procedure was worth it, there's a lot of things you take into consideration. One is cost, one is discomfort, one is downtime, and then there's the results. And so if you're uncomfortable for 30 minutes to 2 hours and your price point is not low, but it's kind of in the middle, I'm going to want some pretty impressive results. And sometimes it did deliver it, and sometimes it was a little bit more subtle and harder to tell. It was worth it for some of the people, but many of the people that I did the procedure on, I would say that they would say it was okay or maybe not as worth it. And so whenever I talk to patients, I like to have confidence in what I'm telling them and that this procedure, will deliver this with a certain amount of certainty. Nothing certain in this world, but a certain amount. But the variability of the results in combination with it was kind of an uncomfortable procedure. It is kind of hard for people to do. When I first started doing facial plastics almost 15 years ago, people would say, oh, you do this procedure and it will make your skin healthier, it will produce collagen, your skin will be in a better place. If you ever decide to do a facelift, or your skin will be healthier, afterwards as compared to if you didn't do anything. The thing is, you can't really do a study to prove that or disprove that. So that's just something that people say. Something that we've found now doing surgeries on people that have had this treatment or had it multiple times is it does make the surgery like a facelift harder. So you're stimulating collagen, but that does mean creating scar tissue. Maybe it's in the way that you want, and maybe it's not so much in the way that you want. One of the things that you'll see if you're doing research on the internet about Ulthera is that it melted the fat in my face. It's hard also to prove that this is the case or not. You can find stories to support that. You can find evidence that it doesn't do that. Hard to know because it is a tool. It is it's a microwave type of a treatment, and the person doing it really matters. And so the way that you do the treatment, the depths that you go to, how much energy you're putting in can make a very different treatment for something that's very light that you really, surgically later can't tell that they've had it done or not, all the way up to there's significant scarring. It is very difficult. And so that is something objectively that I can say there are differences in how people are doing this treatment. So it would make sense that there would be some people that may experience more of this fat atrophy compared to others. Even with the technologies that we use in my office right now, I don't go to depths below 2 millimeters above basically where your mouth is, because all of this fat above that is the good fat, the youthful fat, the fat that we want to keep, and we want to lift the skin above that. But if we're doing any sculpting, anything of that nature is all below that area. And the areas where you have jowls and underneath your chin, if a little bit of that fat goes away, usually people are pretty happy about that. Theoretically, you can do that. And if someone was very, very aggressive with these treatments and they went really too deep with too much energy, potentially you can do that. But they would really, really have to try, because I have taken care of patients who had fat transfer from other surgeons, and I used these technologies to try to get that fat to go away because they didn't like where it was or the way that it looked. And it took multiple treatments on pretty high aggressive settings to be able to see a difference. And even then it wasn't gone, but it was a lot better. So does Ultherapy melt the fat in your face? Maybe. It could if you're very aggressive with it, but you really have to try to get there. So that is possible that could be a potential complication. You do have a potential to have nerve damage from Ultherapy, which is not something that I see or hear of with some of the newer technologies like microneedling with RF, like your Morpheus, your Secret RF, things like that. Because you're applying a significant amount of heat in the areas where nerves do live, you can produce some damage in them. In the many patients that I saw that had Ultherapy, there were some that had some numbness in and around their ear, because there's a nerve that runs right there underneath your ear. It did last for a couple of months. There, you do see this in the case reports, and that is the thought, is the heat damaged those nerves, but not permanently to where they do come back. I've never seen nerve damage in and around the mouth, but that is something that has been reported. And if you're doing a treatment where that is a potential that you can have nerve damage in and around your mouth, where it would affect the way that you smile, you talk, you interact, that better have really good result, potential for a really good result, because that risk can be very upsetting to the patient and to the provider and to the physician for the months that it persists. Like I said, I've never seen it, but that is a potential and it can happen. And like I said, it depends on who's doing that treatment and how knowledgeable they are about the anatomy, and they're staying away from those important nerves. But when people get these procedures, often they're in places like med spas, and they may or may not be someone that is, a nurse or a PA or NP or a physician that's doing it. It could be a number of different people. So the risks that go along with Ultherapy, to me, outweigh the good, because the results are so variable that you could have a knock it out of the park, amazing result, or it could be kind of about the same. But then you have the risk of permanent change in the fat in your face, potential nerve damage, and then potentially more difficult surgery in the future if that's something that you decide to do. It is not my choice in non-surgical treatments to tighten the face. I think we have a lot better technologies at our fingertips now, and I think that's something that you'll see as you do your research and you find those technologies that fit with your budget, with your lifestyle, with your goals. And also, whenever you go to see a facial plastic surgeon and you do a consultation, you can have a discussion about all of these, and that person should walk you through all the different options and what all the pros and cons are of each, even if they don't have those particular technologies in their office. Let me know if you have any more questions about skin tightening or about Ultherapy. You can find me at www.drangela.sturm.com.